Hello, welcome to Forge. My name is Beth Chandler. I'm a physical therapist and certified lymphedema therapist. I also serve on the clinical advisory board here at Forge. We're here to help you and serve you with all your needs during your breast cancer journey. You may have recently received a bag or box from Forge that includes a stress ball or exercise ball. I'm here to give you some guidelines and tips on use of the ball as you go through surgery, treatment, and/or lymphedema therapy. I'd like to go through some guidelines for use of the stress ball and things to avoid or precautions during your treatment for breast cancer. If you've had a recent infection following surgery or any risk of blood clots, then you would want to hold off on use of the ball during that time until your physician or surgeon gives you the okay to go ahead and exercise. Some other precautions would be any surgical precautions, such as following a mastectomy. If your surgeon doesn't want you to raise your arm over shoulder height, then you would want to make sure to follow those surgical precautions first and foremost prior to use of the stress ball. If you have any pre-existing joint limitations, such as problems with your wrist or fingers that were occurring before surgery, then also use that as a guideline. I don't want to do anything to create additional stress on the joints during your treatment and recovery for breast cancer. If you have any pain following surgery, use this as a precaution. It's not necessarily something to avoid exercise, but do seek the consult of your healthcare professional or your surgeon if you're having pain that wasn't there prior to surgery. Following surgery for breast cancer, you want to make sure to monitor swelling in your arms, especially if you've had bilateral mastectomy or on the affected side. Be sure to take your jewelry on and off daily, such as your rings and watches, as this can be an indication of swelling following surgery or the presence of lymphedema. Be aware of your breathing when you're exercising or doing exercise of any kind. You want to make sure that you're taking slow diaphragmatic breaths. This will help with your recovery, it will decrease your stress, and it's a good practice during your exercise.